topic is student counseling services. As a teacher, I say that you are also a counselor. What type of, how do you handle the issues concerned with students? That's the topic. The presentation goes in the following way. First part is the terms used in the presentation. These terms are confined to the topic which is assigned to me. Second part is the theoretical part. And the last part is the application part of it. The terms used in the presentation. Who is a counselee? Who is a counselor? Counselee means the person who receives services is called counselee. He is also known as client, beneficiary, mentee, or protege in different contexts. Counselee means the person who receives the services. Counselor means the person who provides services. Counselor is a professional who provides services to persons who are in need of help. He is a service provider. Counselor is a service provider. Counselee is the receiver of the services. Counselor are also known as therapist, that means who treats the problem, mentor, helper in different contexts. But we use the word counselor throughout. We also use the word client. Now, who is client? Client means a person who is in need of help. Or we say the person who seeks help. Or a person who is provided help is called as client. I repeat again, client means the person who receives the services. Either he comes on his own and gets the service, or you go to him and provide services. He is called client. If a person goes to a doctor, he is called patient. If a person goes to a counselor, he is called client. So client has certain rights. The right to receive help, the right to refuse help also both. As a teacher, you are duty bound to provide services to him. As a counselor, it is your duty to provide service to him. You are providing services not out of compassion, not out of sympathy. You are providing services because you are duty bound to provide service. You know how to help people. You know how to provide services to people. That's why we say that you are a counselor. I presume that every teacher is a counselor. You have all the qualities to become a counselor except one that I will explain to you later. At international level, certain requirements are there to become a counselor. I will list out all the qualities, except one, probably you have all the qualities. So friends, I repeat, counselor is the person who provides services. He is a professional, he is a trained person. He knows how to help people. Counselee means the person who receives services. He is also known as client. In industry, he is called as a mentee or protege. In different contexts, we have different terms. But broadly, we say counselor means the person who provides services. Counselee means the person who receives services. There are two kinds of help which we provide. One is called proactive help, and the second one is called reactive help. What do you mean by proactive help? Doctor provides help to the patient. Lawyer provides help to the client. The counselor also provides services to people. But the services are of two types. One is proactive, other is reactive service. Reactive service means when a person requires help, when he comes to you for help, when you provide services to him, or when a person requires services, voluntarily you go to him and provide services. This is called as reactive service. You are reacting to the requirement of the person. The person requires services. Some people come to you. I say some students come to you for help. You provide help to them. There are some students who require help, but they don't come to you. They don't know of approaching you also, but still you voluntarily go there and provide services to that person. This is called as reactive help. You are reacting to the requirement of the person. Proactive help means providing service is your requirement, not the other person's requirement. That means you get satisfaction by providing services to people. This is your requirement. This can be compared to that of dana. For example, dana ಮಾಡುವುದು ನಿಮಗೆ ಬೇಕಾಗಿರಬೇಕು. You require dana ನೀವು ಕೊಡಬೇಕು. Nobody has come to you and asked for dana. ಈ ಸಹಾಯ, ಈ ದಾನ ಮಾಡುವುದು ನಿಮ್ಮ requirement. Providing service is your requirement, your self-satisfaction. For my self-satisfaction, I am providing services to people. This is called as proactive service. So providing service is my requirement. When I feel, it is called proactive. So, but in India, the term counseling, the term counselor, they are not protected terms. Protected terms means legally they are not protected, except in few occasions. If you call yourself a counselor, nobody will object. But you can't call yourself a doctor without having the qualification. Same way, because I belong to social work profession, I say social work or social worker, these two are not protected titles. Anybody can say that I am a social worker. There is no objection at all. But people to say that he is a chemist, he should have qualification in chemistry. To say lawyer, you should have qualification in law. But to say that you are a counselor, you need not have qualification except in few occasions. In other contexts, what is required for a person is a kind heart. If you have a kind heart, if you want to help people, if you want to serve people, you can be a wonderful counselor. Okay, the next term which we use is code of ethics. Code of ethics means a written set of ethical and value-based principles for any profession. Written set of ethical and value-based principles for a given profession. Law has certain code of ethics. Medicine has certain code of ethics. A person who wants to practice or who wants to practice as a medical professional, he should follow these code of ethics meticulously. And you have to follow. Certain codes are in written form. Certain are not in written form. Certain are adjudicable. Adjudicable means when you violate the ethics, there is a punishment for that also. So certain ethical issues, if you violate, for example, confidentiality is an ethical issue. If you violate confidentiality, if you publish the patient's information in a newspaper, you are liable to be punished. Same way, we can say that you should not accept any gifts from the patient. Suppose you accept a gift, that is also unethical. So, counseling also has certain code of ethics, which you have to follow. Some of the code of ethics I will explain. Treat everyone equally. There should not be any discrimination. Maintain confidentiality. Whatever information that is given by the client should be kept confidential. Do not cross boundary line. Don't take up cases which are beyond your capacity. Do not use authority for your personal purpose. There should not be a dual relationship. Dual relationship means having two types of relationship with the person. Do not promise if you are not able to keep it up. These are all some of the ethical issues which a counselor has to follow. These ethical issues will guide you, will direct you, will take you to the destination. This is called code of ethics. Follow these code of ethics. Every profession will have a code of ethics. One has to follow. Next term which we use is confidentiality. Confidentiality means whatever information that is given by the person or by the client should be kept confidential. This is an ethical principle, a moral principle too. When the person comes and informs you, Madam, nanu nimma hatra ondu vishaya helabeku andre heli. I will keep everything confidential. Trust me, believe me, and tell me all confidential, any information. I promise you that whatever information you have given, that will be kept confidential. It will not be shared with any person without your permission. This is called confidentiality. This will improve, increase the trust, the relationship between the two persons. People trust you. But after believing you, if you disclose this confidential information to the public or to the newspaper, to any other medium, that means it is a breach of trust. Nambika droha madidina artha. Nambika droha andre nanu nimmannu nambide. Nambi ella helida mele you have shared this information with somebody, and that has created a lot of problems. So there are two types of confidentiality. One is absolute confidentiality, and the second one is relative confidentiality. Absolute confidentiality means whatever information the person gives to you will be kept confidential, will not be shared with anyone, will not be even recorded also, will not be made a note of things anywhere. It will be kept in my mind only throughout. This is called absolute confidentiality, which is practically not possible. Practically not possible. What is being followed is relative confidentiality. I will keep it confidential only in certain occasions only. When the law demands, when the court asks for information I have to give, I can't say confidential. When there is a threat to the individual, I have to disclose. Only under certain circumstances, tell the person, only under certain circumstances only, I will reveal the information, whatever you have given, but otherwise I will keep it confidential. You can trust me, you can believe me. This is called confidentiality. Next comes the healthcare professionals follow confidentiality. Patient's record is a confidential document. Patient's record should not be handled by some unconcerned person. Patient bandre, a patient ಬಗ್ಗೆ ನೀವು ಬರೆಯುವಾಗ, if patient wants, I want to see my record, you have to show the record to him. If somebody third person asks for record, you should not give. So record is a confidential document which should be kept under lock and key. In research also, when the subject gives information to you, data to you, you will keep it confidential. You will assure that whatever information you give, that will be used only for the research purpose only, not for any other purpose. I will not disclose any identity information in the thesis. I will keep it confidential. Certain information in business also is confidential. So, personal information is a privileged information. Okay, comes next is diagnosis. There are two types of diagnosis. One is a medical diagnosis which doctors use. Medical diagnosis is different from psychosocial diagnosis which we make. In medical diagnosis, the doctor examines the patient, sends the patient for all investigations, get the clue from different reports also, talk to the patient and talk to other persons also, arrive at a conclusion that is called, arriving at a conclusion that is called labeling the person or saying that the person has a problem. What is the problem? That is called diagnosis. At the end, you make a diagnosis. You say so-and-so person is suffering from TB. You say so-and-so person is suffering from cancer. This is my diagnosis. But a good doctor will never make a diagnosis in a hurry. Don't make a diagnosis with incomplete information. So, diagnosis should never be in a hurry. When once you make a diagnosis, you will go in that direction. Only sometimes your diagnosis is wrong and you are going in the wrong way. Many doctors, what they do is they make a tentative diagnosis. That is called provisional diagnosis. They look at the other things also, but provisionally, I say it is a case of tuberculosis. The signs and symptoms are more in favor of tuberculosis only. But there is a possibility that it may be a case of pneumonia also. I don't forget that. So my first diagnosis is tuberculosis and second diagnosis is pneumonia. This is called as a provisional diagnosis or tentative diagnosis or differential diagnosis you make. Differential diagnosis. A good doctor will never be in a hurry to make a diagnosis. A good doctor will take more time for diagnosis and he requires less time for treatment. The bad doctor is exactly opposite. But what we make in counseling is psychosocial diagnosis. What is the problem of the individual? What type of person has the problem? And what is the environment in which the person is living? What are the other factors that contribute to his problem? And what is the prognosis? And how to handle this problem? All put together is called as psychosocial diagnosis. I have used one word called as, known as prognosis. Generally, doctors use prognosis term also. Diagnosis, next comes prognosis. Prognosis means the chances of recovery from the problem. Problem can be treated very easily. This is called as prognosis is good. There are favorable points for the treatment. The duration is less only, not much. The person has developed a problem only since 2 days. The patient is very cooperative. Financially, he is very sound. The family is interested in the welfare of the person. All are favorable points for the recovery of the problem, for the recovery from the problem. This is called as good prognosis. Good prognosis means the chances of recovery from the problem are plenty. You can be optimistic. This is called good prognosis. Bad prognosis means difficult to handle the case, difficult in recovery. The person has come in the last stage of cancer. I'm very sorry, the recovery is very, very slow. I'm not sure of the recovery. The prognosis is bad. This is called as prognosis is bad. Good and bad. Good means recovery is possible, treatment is possible, treatment can be very quick also, whereas a bad prognosis means slightly hopeless case, slightly difficult to treat. This is called as prognosis. Okay, friends, next term is empathy. The term which we use, empathy. Empathy is different from sympathy. Sympathy means feeling for people is called sympathy. Feeling like the person is called as empathy. Ayyo papa andre sympathy. I understand your problem. I'm sorry for the loss. I heard that you have lost something in the business. I'm sorry for that. This is called sympathy. Feeling pity. Ayyo papa. Ayyo nimage ee tara dukha agideya annodu. This is called sympathy. Sympathy will not fetch you anything. Sympathy is not good. Sympathy will not solve the problem. Sometimes sympathy will aggravate the problem also. Sometimes sympathy will increase the intensity of the problem also. What we need is not sympathy. What we need is a helping hand called as empathy. Empathy means I understand your problem. I understand your problem. That means ಅದೇ ಸಮಸ್ಯೆ ನನಗೆ ಬಂದರೆ ಎಷ್ಟು ನೋವಾಗುತ್ತನ್ನೋದು ನಾನು ಅರ್ಥ ಮಾಡಿಕೊಂಡು ವಾಪಸ್ಸು ವ್ಯಕ್ತಿಗೆ ಹೇಳಿದರೆ ದಟ್ ಇಸ್ ಕಾಲ್ಡ್ ಎಂಪತಿ. Empathy means feeling like the individual. I understand your problem. I imagine as if I have the problem. If the same problem comes to me, how much painful it is, I experience and I convey my experience to you. This is called as empathy. Empathy is good. Empathy means it is the ability to understand the problem of other persons as if we are having the same problem. This is called empathy. I understand your feeling. I can feel the pain. ಪರೀಕ್ಷೆಯಲ್ಲಿ ಫೇಲ್ ಆದರೆ ಎಷ್ಟು ನೋವಾಗುತ್ತೆ ಅನ್ನೋದು ನನಗೆ ಗೊತ್ತಾಗಿದೆ. ನನಗೆ ಗೊತ್ತು. ಸೊ ನಮ್ಮ ಮುಖದಲ್ಲಿರುವ ಭಾವನೆಗಳ ಬದಲಾವಣೆ ಆಗುತ್ತೆ. This called as I feel like you. I understand your pain. So this is called empathy. Empathy means first you listen to him. Second, understand his feelings. Third, experience the feelings. Fourth, communicate back the same feelings to other person. Then it's called as empathy. I have to communicate back to you. I understand how much pain it is, how much painful it is. Cancer ಬಂದ್ರೆ ಎಷ್ಟು ನೋವಾಗುತ್ತೆ ಅನ್ನೋದು ನಾನು ಅರ್ಥ ಮಾಡ್ಕೊಂಡಿದ್ದೆ. ತುಂಬಾ ನೋವು. ನನಗೆ ಆ ಸಮಸ್ಯೆ ಬಂದ್ರೆ, ನನಗೆ ಆ ನೋವು ಆಗಿದ್ರೆ ಎಷ್ಟು ನೋವಾಗುತ್ತೆ ಅನ್ನೋದು ಅರ್ಥ ಮಾಡಿಕೊಂಡು ಆ ಅರ್ಥ ಮಾಡಿಕೊಂಡಿದ್ದು ವಾಪಸ್ ವ್ಯಕ್ತಿಗೆ ಹೇಳಿದ್ರೆ ದಿಸ್ ಇಸ್ ಕಾಲ್ಡ್ ಆಸ್ empathy. So sympathy means feeling like the person and empathy means feeling for the person is called sympathy and empathy means feeling like the person. That's what we say putting yourself in others' shoes is called as empathy. I imagine as if I have the problem. And I understand the pain, agony, and I communicate back to you. This is called empathy. Okay, next one is listening. Listening is different from hearing. What we use in counseling is listening only, not hearing. We hear so many things. Many things will not go to brain also, it will be there only. So what we see is we want to listen. Listen with interest. Listen with concern. And listen to understand, not to respond to you. I listen. At the same time, observation. A counselor should always open his eyes and ears at all times. All the time, keep open your eyes, keep open your ears also. And never fail to register what we see or listen. God has given us 2 ears to listen more and 1 tongue to talk less. Counselor generally talks less. His main role is to listen to people. When you listen to people, that itself will have healing effect. ಇನ್ನೊಬ್ಬರು ಕಷ್ಟ ನಾವು ಆಲಿಸಿದರೆ the person will feel very comfortably. There is somebody who will listen to me. ಕಷ್ಟದಲ್ಲಿರುವ ವ್ಯಕ್ತಿಗೆ ಫಸ್ಟ್ ಬೇಕಾಗಿದ್ದೇನು ಅಂದ್ರೆ allow him to talk. Allow him to express. Don't object. Don't interfere. Let him talk. Listen patiently. Listen with concern. Listen not to argue. Listen to understand. Okay, bend your head towards him and say, yes, I'm listening. I'm understanding. The same way, observation. Observation means seeing and not looking. Looking is different from seeing. We say see, observe. So observe things. Observe the body language of the person. Observe how he answers your question. Observe his facial expressions. Because we believe that face is the index of mind. ಮುಖ ನೋಡಿದರೆ ಮನಸ್ಸಲ್ಲಿ ಇರುವ ಭಾವನೆಗಳು ನಾವು ಮುಖದಲ್ಲಿ ಅರ್ಥ ಮಾಡಬೇಕು. That's what we say. Observation, keen observation, meticulous observation. Next is paraphrasing. Paraphrasing, the word which we use in the research work. When you have referred a journal article, what you do is you read the article, understand things, write in your own words only, without disturbing the meaning, and finally you include the name of the author. This is what we say paraphrasing. Paraphrasing means not exactly copying. When you exactly copy, it should be within the inverted comma. But when you have taken the idea, when you have understood the things in the right perspective and written in your own words, in your own language, it is called as paraphrasing. The same way, paraphrasing has a therapeutic value in counseling. Whatever the client said, whatever the person has said, if you repeat it the same in your own words, now whatever you said, now I understand that you are not happy with your friends in the college. I understand that you have some problem with the teacher. Am I right? This is what you said. If the person said, yes, this is right, that is what we say paraphrasing. So paraphrasing means bringing it to your orbit only and explain things. So this is called paraphrasing. Next is privileged communication. Privileged communication means the communication between you, counselor, and the client is a privileged communication. It should be kept confidential. It should not be leaked out. It should not be made known to unconcerned persons. This is called as privileged communication. Legally protected communication. Okay, next is we have psychiatrist, we have clinical psychologist, we have psychiatric social worker. What is the difference? When you are approaching a psychiatrist, who is a psychiatrist and who is a clinical psychologist, who is a psychiatric social worker? All three terms are legally protected terms. All three are legally protected terms. That means you cannot say that you are a clinical psychologist without having clinical psychology qualification. You cannot say that you are a psychiatrist without having a qualification. The same is true with psychiatric social worker also. They are all protected titles. They are all protected because there is an act called Mental Health Care Act of 2017. In that act, definitions are given for these three. Who is a psychiatrist? A psychiatrist is basically a medical professional. After MBBS, if the person gets MD, 3-year MD or 2-year diploma, 3-year MD in psychiatry or 2-year diploma in psychological medicine, and if the degrees are given by a university approved by Medical Council of India, then we say he is a psychiatrist. A psychiatrist is a medical professional. He is authorized to prescribe medicines. He can give counseling. Certain cases can be referred to him. We can refer the cases to him. For example, if the client is very violent, aggressive, abusive, assaultive, if the person is unmanageable, if the person is having fits, if there is a problem with the brain, all problems are there. Best thing would always be refer him to a psychiatrist who will be able to manage the patient well. Don't handle those cases. So psychiatrist will handle cases. Of course, he will also give counseling, but a higher level. Clinical psychologist means who? A person who has done MA or MSc, or MA, MSc in psychology or clinical psychology or applied psychology, and 2-year full-time MPhil program, clinical MPhil program from a recognized university, clinical full-time MPhil program from a recognized university, and if the qualification is approved by the Rehabilitation Council of India, he is qualified to be called as clinical psychologist. He can give counseling. Psychiatric social worker means a person who has done MSW, and after MSW, if he has done 2-year full-time clinical psychiatric social work qualification, MPhil qualification from a recognized institution approved by the UGC, then we say he is a psychiatric social worker. All three are protected titles. They can handle cases of severe nature. That means we can handle certain cases. If the cases are unmanageable, if you are not able to deal with it, refer those cases to the nearest mental health center. Every college, every university will have a student service center. This center is managed by a professor, a cadre, or a dean. 2 to 3 counselors are there working around the clock. You can be a counselor. You can deal with these cases. And if you are not able to deal the case, if you are not able to manage the case, if you have a difficult case, refer the case to the nearest mental health center. What we say is every college, every university must have tie-up with the nearest mental health center so that you can take their services or you can refer the cases to them also. Okay, next comes rapport. What do you mean by rapport? Rapport means it is a good relationship between the client and the counselor. A close and harmonious relationship between the counselor and counselee. Both communicate well. Rapport means it is a positive relationship, a purposeful relationship, a professional relationship too. I am a counselor, you are the client. The relationship between us is only that much, only, not nothing beyond that. ನಾನು ಒಬ್ಬ ಮಾಸ್ಟರು, ನೀವೊಬ್ಬ ಸ್ಟೂಡೆಂಟು, ನಿಮಗೆ ನನಗೆ ಇರುವ ಸಂಬಂಧ ಅಷ್ಟೇ, not beyond that. This is called as a professional relationship. And that relationship should always move in the right direction only. Positive. And the relationship has a purpose. The purpose is known to both the parties. So this is called as a rapport. Rapport means a strong working relationship between counselor and counselee, built on mutual trust, mutual respect, genuineness, and motivation for growth. Rapport depends on, rapport means ಒಳ್ಳೆ ಅನುನಯ ಸಂಬಂಧ, ಸೌಹಾರ್ದ ಸಂಬಂಧ, ಸಹೃದಯ ಸಂಬಂಧ. ಈ ಸಂಬಂಧ ಬರಬೇಕು ಅಂದ್ರೆ you have to talk well. Talk to the patient person well. How do you talk? How do you respond to his questions? How do you behave? How do you follow all ethical guidelines? So, rapport means good relationship between the client and the counselor. Okay, coming to next one is stress. What is stress? Everyone will experience stress. Stress means what happened to me is not stress. The person who first used the term stress is Hans Seyle, a medical practitioner, first used the term stress. He referred stress as disturbance of the body's homeostatic condition. Homeostatic andre samatulana sthiti. If there is a disturbance to the body. Okay, stress is inevitable. Stress is required. Stress beka andre yes beku. Up to a moderate level, stress is always desirable. ಒತ್ತಡ ಬೇಕು ಅಂದ್ರೆ ಬೇಕು. ಪರೀಕ್ಷೆ ಬೇಕು. ಪರೀಕ್ಷೆ ಇದ್ದರೆ ಒತ್ತಡ will be there. If there is no examination, nobody will read also. Some extent, the stress is required. But too much stress will lead to the feeling of frustration. Too much stress. Suppose you give 10 home assignments tomorrow. Tomorrow you have to bring 10 assignments. That becomes very, very stressful only. So, too much stress may lead to feeling of frustration and insufficient stress also. If the stress is very, very less, that becomes a depressant. Depressant means ಸ್ವಲ್ಪ ಖಿನ್ನತೆ ಬರುವುದು. Stress ಬೇಕು, but stress is required up to an optimum level. We require at an optimum level. Everyone wants stress, but it should be within our limits only. Stress will motivate you. Stress will inspire you. Stress will take you to the action. Okay, we use the word stress and stressor. Stressor means the situation or incident that produces stress is called a stressor. For example, disease is a stressor. Financial instability is a stressor. Academic stress, relationship stress, marital discord, death of close relative, bereavement, unemployment, all are stressors only. Friends, I say that there are two types of personality. One is type A personality and type B personality. I will explain to you the characteristics of type A personality. Some are type A personality persons, some are type B. What is type A? Type A persons are stress prone. They are prone to stress. ಅವರಿಗೆ ಒತ್ತಡ ಜಾಸ್ತಿ ಬರುವ ಅವಕಾಶ ಇದೆ, stress. Type A. What type of characteristics you see? They are aggressive type of persons. They are aggressive. They are ambitious. They are highly competitive. They lack patience. They don't have patience. They don't wait for things. They are hostile. They are diligent. Diligent means they are very, very careful in doing things. Hardworking, meticulous, and workaholics. These are all the characteristics of personality A, type A personality. And these persons are more prone to get hypertension and cardiac problems because they are stress prone. They are highly competitive. They are very ambitious. They want to achieve things in their life. They don't have patience. Round the clock they work. Type A, they are more prone to, they are predisposed to psychosomatic problems like cardiac problem and hypertension. Type B personality. What type of characteristics you see? They are very, very peace-loving people, relaxed, easygoing. They avoid competition, less stressful, flexible, prefer collaboration, enjoy company of others, avoid conflicts. They don't strive to please anyone. Type B personality, very much relaxed type of persons. They are not in a hurry. They don't run for the goal, but they do the work. They are quite flexible, not very rigid. They are less stressful. Those people are very happy. So type B personality persons are well adjusted and happy, and type A are more prone to stress. Friends, there was a study long back in 1967, Holmes and Rahe, two scientists have done the work. The work is concerned with identifying the stress score, the stress value. And the author has prepared a list of 43 life events. 43 life events. For every life event, a particular score is given. And we ask the person, read all the events all the incidents in the list, and give me your score if this happened to you in the preceding 1 year. Andre 2014 ಫೆಬ್ರವರಿಯಿಂದ ಈ ಫೆಬ್ರವರಿವರೆಗೂ ನಿಮಗೆ ಈ ಘಟನೆ ಆಗಿದ್ದರೆ, ಈ ಸಮಸ್ಯೆ ನಿಮಗಿದ್ದರೆ, ಈ ಸಮಸ್ಯೆ ನೀವು ಎದುರಿಸಿದರೆ, give us that score. If you have experienced the same thing in the preceding 1 year, and we give score, the highest score is given to the life event called as death of the spouse. Death of the spouse, The stress score, the stress value is 100. If a person has lost his spouse in the last 1 year, he gets a score of 100 stress score. This is the highest score one gets. Divorce, the score is 60. Separation from living partner, 60. Marriage, 45. Retirement, 40. Trouble with the boss, 20. And minor violation of law like traffic rules violation, the score of 5. Like that, we have 43 life events are there. If those incidents are present in the life of a person, give the score, and at the end you get the score. The maximum score one can get is 1,330. This is the maximum score. Now we are giving classification. If the score is 150 and less, we say that low level of stress is there. The person is free from stress. Low level of stress. If the score is between 150 and 299, we say he is experiencing moderate level of stress. And there are more chances of developing stress-related disorders. The chances are up to 50%. Stress-related problems like hypertension, like heart problems, lifestyle problems, the chances are 50%. And if the score is more than 300 and more than that, it's called as a high-level stress. The chances of developing stress-related disorders are almost 80%. So stress-related problems. So stress is becoming a big problem in the modern days. Okay, the last one is summarizing. What do you mean by summarizing? This we use it at the end only. I'm sorry. Summarizing. Summarizing means at the end the counselor would discuss what is that we have our journey, with what problem you have come to me initially, what is the progress you have made now, is there visible improvement in the condition, and what you are expected to do afterwards. This is called as giving a summary of your service. This is called as summarizing. Okay, friends, we will go to the next one. What is counseling? Counseling does not mean providing advice. Advice giving is not counseling. Providing a ready-made solution, this is also not counseling. So we don't provide ready-made solutions. We don't have advice also. This is not counseling, but sometimes we do this also, very rarely. Counseling means enabling the individual. Counseling means empowering the individual, making the person powerful. This is called counseling. Different professionals practice counseling. Like health providers practice counseling. Advocates practice counseling. Teachers practice counseling. Managers practice counseling. HR professionals, project leaders, religious leaders, custodial care professional like jail officials and juvenile home officials all provide counseling services. And what is counseling? Counseling is a behavior change strategy involving direct contact with a client and is by definition a remedial process. Counseling means bringing a change in the behavior of the individual. We can bring a change in the behavior from negative behavior to positive behavior. We can correct the behavior of the individual. but that involves a direct contact with the client. It is face to face. You sit before you, he sits face to face. And by definition, it is a remedial process. Remedy means solution or treatment process. This is one meaning of the term counseling. It is a behavior change strategy involving direct contact, face-to-face contact with the client. I repeat again, client means the person who has a problem, or a person who is in need of help, or a person who requires help. We call him as a client. So counseling means bringing a change in the behavior of the individual. Second definition is, essentially, counseling involves an attempt to help individual to mobilize his own resources and utilize them to resolve certain difficulties which confront him. The purpose of counseling is to enable the individual to solve his own problem. Counseling means helping the individual to help himself. Many of the problems can be managed well by us only. Only thing is, we may need certain guidance sometimes. But God has given us the strength. The person has the capacity in him. The person is talented. The person is skillful. He can manage his own problem. That's called as self-help. The third meaning is, counseling involves a professionally trained counselor assisting a client with a particular concern. So counseling involves a professionally trained counselor. Professionally trained counselor means, I say, a particular qualification is to be required. And if you get a certificate, that would be good to practice counseling. That is also possible. Okay, next definition is, counseling is to empower the client. Counseling is to make the client powerful. Empowerment means making the person powerful, not giving power to the individual. Making him powerful to cope with life situations. Coping means managing life situations like events, occasions, conditions, so many things in life situations. If you are able to manage well, if you are able to handle well, performing a marriage, performing a particular assignment, they are all events. If you are able to manage well these things, that is the purpose of counseling. Counseling is to empower the client to cope with the life situations, to reduce emotional stress of the person, to reduce emotional stress. Reduce the stress. When you talk about emotional stress, we refer to depression and anxiety. These two were the major mental health problem during COVID-19 time. Depression especially. Anxiety means edo ondu bhaya, gottilla. Anxiety. When the person is anxious, what happens? A person who is anxious, which you also experience. A person who is anxious, the heartbeat goes up. The pulse rate goes up. There is sweating all over the body. More so on the forehead. Trembling. Trembling. Unable to walk. Unable to sleep. Unable to enjoy the food. Sleep disturbances. And frequent urination. Mild diarrhea. All are symptoms of anxiety. The person is severely anxious. Eniki anno odu chikka samasye irbodu, very much anxious. Depression, exactly another problem. Depression is a major mental health problem. Khinnate, dukkha. Dukkha is too much. The person comes to the class sitting at the back bench, unusual behavior. ಯಾವಾಗ ನಾವು ಲಾಸ್ಟ್ ಬೆಂಚಲ್ಲಿ ನೋಡಿಲ್ಲ ಅವನಿಗೆ ಬಂದ ಯಾರ ಜೊತೆಗೆ ಮಾತಾಡ್ತಾನೆ ಇಲ್ಲ. He comes alone, sits at the back, doesn't interact well with the people. He will go on his own, go home. Personal hygiene is not maintained well. Nagu irodhe illa. If at all he smiles, it is an artificial smile only. Dukkha. At home, put off the light, sit in darkness, look at the sky, not enjoying the food against him. Sleep disturbances, that is early morning awakening. ಇನ್ನೂ ಜಾಸ್ತಿ ಕೇಸಸ್ ಅಲ್ಲಿ ತೂಕ ಕಡಿಮೆ ಆಗುವುದು. Not having interest in life, suicidal tendencies, suicidal ideas. All put together, we say it is emotional stress. Reduce the intensity of it. Many of these problems can be managed well. But some of the problems cannot be managed by you. You have to refer these cases to the nearest mental health center. That's what I said. A case of a depression, send the person to the psychiatry department. They will manage the case very well. Anxiety, severe anxiety, restlessness. Engage in the growth-producing activities. Counseling does not mean only solving the problems of people. It is also growth-oriented. In the college, you can conduct different programs. Stress management, you can have a debate on that. Suicide prevention, you can have a discussion on that topic. Life skill education, you can provide this type of topic to the young children. This is to engage in growth-producing activities and to make effective decisions. What we want at the end is let the person take a decision which is good. Okay. Last one is counseling means rendering intellectual and emotional support for helping and developing a distressed person. Distressed person means a person who is in distress. He is called a distressed person. Please understand again, I say, stress is not to be viewed as good or bad. It is our reaction to the stressor speaks of the stress. ಪರೀಕ್ಷೆಯಲ್ಲಿ ಫೇಲ್ ಆಗುವುದು ಅನ್ನುವುದು ಒಂದು ಸ್ಟ್ರೆಸ್ಸರ್ ಆಗಿದ್ದರೆ, how I react to the failure is the stress. If I take it very lightly, there is no stress at all. But if I take it very seriously, the stress is more. It is my reaction to the stressor is the stress. My reaction is in my hands only. So I can be in other way also. Parikshadalli fail aguvodu, it is not a great thing. You can appear for the examination once again and get a better mark. We also say sometimes self-disclosure. There is a concept called as self-disclosure in counseling. Self-disclosure means sometimes you can disclose your own life incidents also, which will help other persons to solve their problems. Example, if the person say, if they failed in the examination, you can say, failure is a common thing. Nanu fail ade, nanu. Self-disclosure, I am disclosing things which happened in my life. It happened to me also. But nanagenu astu dukkha pattilla. I took it as a challenge. And I appeared for the examination and I got a good mark. That should be the challenge. Same thing has happened to me. So you can also be in the same way. This is called a self-disclosure. But don't use it artificially. Don't create something on your own and express. If it has really happened, and if it is really necessary to explain, don't disclose your own life for the sake of marketing your image. That is not correct. I don't market my image. I don't say something, Nanu, I also got 100 out of 100 marks, which is not true also. So never boost. When the situation warrants, give your life illustrations also. That will be a solution. Okay, friends, next is counseling services in higher education institutions. Many universities have set up student service centers. Colleges and universities, it is mandatory now. Please understand, it is mandatory that every university, including deemed universities, must have a student counseling center on the campus. Student counseling center, or we say higher counseling service centers. All traditional colleges, all traditional institutions, all traditional universities, profession-oriented institutions, colleges, and polytechnics all should have student service centers on the campus. These centers have to work in close liaison with the mental health centers, nearest mental health center. And we have counselors are placed on the campus to meet the psychosocial needs of the students. The center guides the students towards academic, professional, and personal success. All three things are important. The center mainly to manage, the centers mainly are to manage problems related to stress and emotional adjustment. Every center is to be managed by a professor cadre, a professor or a dean. And we have specified the disciplines also: psychology, social work, sociology, and sports department, physical education and sports. And you can have counselors. These counselors will provide counseling services to the students. What type of services? There are mainly 4 types of services we provide. One is services during normative stressors. Normative stressor, it is there. Next slide, I'll show you. The centers help students to cope with issues connected to normative stressor. Normative stressor means this stressor is predictable, is expected. For example, academic problems are expected. Academic problems. Next, relationship problems, relationship with people problems. Family-related problems, including cases of economic issues. Substance abuse problem. Attendance problems. Dropouts. These are all called as normative stressor. Again, I say normative stressor means they are mostly predictable. Stressor means the cause for the stress is called a stressor. Parikshadalli fail aguvodu, this is called a stressor, leading to stress. Normative stressors means academic problems, relationship problems, family-related issues, cases of substance abuse, cases of attendance problems, cases of dropouts. Non-normative stressors means they are not expected, they are unexpected life events. They are unexpected life events. For example, accident, serious illness of a family member. They are called as non-normative stressors. Adjustment difficulties. Students are not able to adjust with others. Some students are not able to adjust with the system. You have to help them. Next one is life transitions, especially after completing the course, taking up a new job, moving away from friends. During this time, you can provide services to them. A subject on mental health is to be included in the curriculum. That's the recommendation. It is to be included in the curriculum. And the student service center should be managed by a professor, as I said, either a director or a dean level position equivalent to a cadre of the professor rank. And the student service center will maintain a register. The register containing the names of stress-prone persons. Stress-prone persons. Those who are prone to get into stress. Those who are at the borderline. Those who are not mingling well with the people, those who are seclusive, those who do not interact well with people, those who do not communicate, identify the risk group. Make a note of those things and provide services to them. So, this center will provide services to students, especially during examination time if there is a problem of examination fear. Confidentiality is to be maintained completely. All records are to be maintained properly. I say that there are broadly 4 forms of counseling, 3 forms of counseling. Whichever is possible, you can do it. One is face-to-face counseling. Face-to-face counseling is the traditional form of counseling. It is practiced even today very widely. Face-to-face counseling, where the person comes to a counselor, sits before him, and they interact and understand the problem and solve the problem. This is a traditional way of counseling. The client or the counselee meets the counselor personally. You go there, sit before him, and talk to him. This is called as face-to-face counseling. The most admired method, the most accepted method, very, very popular method of counseling is this. We also have online counseling, which became very, very popular during COVID-19. It is online counseling. It works as good as face-to-face counseling. More convenient in terms of time and energy. Clients can speak from their house or from the workplace. Less expensive. You need not go to him, wait in the queue and meet the person. Online counseling will save you time, effort also, less expensive. And you need not spend much time in the travel. So it is as good as face-to-face counseling, but one problem is privacy may not be there. There is no anonymity. People, we can't depend on the mission completely. So one advantage of online counseling is you are not identified by people. When you go to a counselor physically, people may look at you. That's why he has come to a mental health professional. ಇನ್ನು ಹೇಳಬೇಕು ಅಂದ್ರೆ ಇವರೇನೋ ಮಾನಸಿಕ ಅಸ್ವಸ್ಥ ಇರಬಹುದು ಅದರಿಂದ ಬಂದ್ರು ಅಂತ. People try to avoid going to a psychiatrist physically because I don't want to be identified by people. I don't want people to notice me and to call me also there. Online counseling is always good. It is no stigma. No stigma of counseling or consulting a counselor. Nobody knows, nobody understands because it is online. So online counseling, it is better, but the best is only face-to-face counseling. There is one more type of counseling is called as telephone counseling. Telephone counseling is different from face-to-face counseling. Only thing is, in face-to-face counseling, you talk to the person. In telephone counseling, you talk to the person over phone, that's all. But in the past, this medium was predominantly used in crisis intervention. Crisis intervention was a technique used. Crisis andre unexpected problem. I'm sorry. I'm time ಆಗ್ತಾ ಇದೆಯಲ್ಲಮ್ಮ? Amma, am I exceeding the time?
Yes, sir. 11:15 is the break. Sir.
Okay. Shall we have a break now? Okay, friends, we will have a break
till,
now.
11:45 we have break, sir.
Okay, it's 11:15. Now we'll break now. We will again reassemble at 11:45. And those who have questions, please make a note.